a guest speaker. We have a guest speaker with us tonight who's actually going to be sharing some secrets with us, some things that we need to know. You know, the majority of you guys that are on here are very big into the life side of the business. You're into finding solutions for people, for problems before they ever happen, right? That's what we do, and we're good at what we do. And so this is another way that we're going to be able to help our communities. We're going to be able to feel really good about what it is that we're doing. And it's a really wonderful pivot conversation for all of the other products that we help people with. However, it's going to be mind-opening, eye-opening for a lot of you guys that are hearing about this for the first time. And so I'm going to go ahead and turn this over to Mr. Clay Peak, who's the owner of Peak Performance Insurance, guys. He has a wealth of knowledge, and I have, had the opportunity to see the way that he works and operates, and he has an incredible team behind him. You say you can learn a lot about somebody by those who support them and back them up. And when I tell you that he has a great group of people who really respect him, work with him, and they work like a fine oiled machine. And that's what's important to success in any kind of business, right? It's your systems, it's your knowledge, it's who you're working with, who's behind you. And we've been on this grind, a lot of us, together for a couple of years. And so I'm excited that we're able to bring something new to the table to be able to help people. And so without further ado, I'm going to go ahead and I'm going to turn this over to Mr. Clay Peak. He's going to share with you all of his great information that he has been learning since 1996, you guys. So I'd say he's got some experience on this. So grab a piece of paper, grab a pen, mute your phone out, write down your questions in the chat. We're going to get to them at the end. And then we'll get all your questions answered. Clay, the call's yours.
Great. Thanks, Jennifer. So glad to be with you guys. I'm Clay Peak. I'm calling from the backyard of my house in South Carolina, in Greenville. It'll probably be dark by the time we finish, but I'm going to talk really fast and cram a lot of information into a very short time. I want this to be powerful and impacting. I think the first thing you should do is take out your phone and take a picture of this page. I'll explain more why later, and I'll come back to it later if you miss it. But what we're going to do is entice you into this market with the tremendous value that we're going to present to you. And this will help you know what to do next. Taking this information will be very helpful to know how to take the next step together. Also on the call is my colleague, Greg Fortune. Greg is listening in from his vacation. And are you in Hilton Head, Greg? Where are you, buddy?
Yeah, Hilton Head.
Well, very good. We're glad to have Greg. And thank your wife for not punching me next time she sees me because I'm on vacation. But we're so glad to be with you guys. As she said, I started selling health insurance in 1996 before some of you were born. And that was my second career, by the way. So I'm very, very old. Be gentle with me, okay? You don't know how hard it is to be this old. So, but we got a lot to share. It's gonna be very important. I'm kind of stalling just for a minute because I know that Jennifer has some folks who are texting her and emailing her about the password. So I'm going to start in about 30 seconds. As I do so, what I'd like you to do is there's a chat box or a question box somewhere. You can type in your questions. And as we get to the end, we will answer all the questions. Now, tonight's class is going to go in two parts. Give me a few minutes to kind of give you the value proposition as to why what I'm going to share tonight is a great idea. Okay? At about the halfway point, I'll say, listen, if I haven't convinced you by now that it's a good idea, thank you for coming. You can hop. The rest of you, I'm going to blow your mind with some other information. So if you decide, hey, I've heard enough, I don't think it's for me, it's okay. You can bail. I'll kind of give you the halfway point where we're at that point. I'm telling you, most you're going to want to stay because this is crazy what's going on. So having said that, let me shoot the door open and let's start this thing going. So if you're a person of a certain age, get my clicker to work here. Let's see. Don't do that to me. It was working just fine a minute ago. Huh. It's fighting me now. Let me just check one more thing. There we go. If you're a person of a certain age, maybe you were in middle school too in the early 1970s. You read Mad Magazine every week. Well, this is Alfred E. Newman, and Alfred's had a pretty tough week so far. It looks like he's been beaten up pretty badly. Well, Clay beat him up because Clay had started beating his assumptions about the ACA, about the Head and Shoulders, because he thought it was not profitable. He thought it was hard. He thought it took too long. He heard that it didn't pay any money and that you didn't get paid sometimes even for the business you wrote. And so the next few minutes, I'm going to take a moment in Christian love to kind of beat your assumptions about ACA, which may be incorrect about the Head and Shoulders, until you realize what you're missing in this space. And you'll forgive me and thank me when I'm done. Now, I realize today that most of you are not health agents, and that's perfect. Most of you are life agents, or maybe you're Medicare agents, or maybe you're worksite or group agents. What I want you to know, first of all, is if you're not in this market, you're literally walking on dollars. I don't want you to change your career. I don't want you to stop doing what you do. What I'm going to tell you is, working with Jennifer and Greg and I, Peak Performance, we're going to help you do more of what you do. If you write life insurance, you're going to write a lot more life insurance. If you write Medicare, a lot more Medicare. But the first thing is to get you to realize that in not engaging, you're just stepping on money. What you don't understand is costing you, because there's opportunity all around you. It's right under your feet. And my job is to teach you how to reach down and pick it up and put it in your pocket. And the first task is to get you to really visibly understand and see, focus in on how big this market is. You really don't understand how big this market is. There are about 14.2 million people in the Affordable Care Act health market. There's about 31 or 32 million when you count those who have a Medicaid version, but you can't sell that, so I'm not going to count that. We're talking about those who just bought a plan who are not in Medicaid. There's about 50 million prospects in this space. Center for Medicare Medicaid Services, CMS, doesn't understand that. Health and Human Services doesn't understand that. Kaiser Family Foundation doesn't understand that. Your insurance carrier doesn't understand that. I understand it because, like you, I've been an agent. I started in 1996 with my wife and 6 kids, having just moved from South Philadelphia, a church where I was pastoring, to go to a new church and start there, working there some. But it was only a part-time job at that time. And so I started selling insurance, and I would drive 800 to 1,000 miles a week, see business owners face to face, have to pitch them something, have to do field underwriting and ask a lot of health questions, and see that most of them wouldn't qualify perhaps a certain appointment or certain days. And then they had to do something really strange. They had to write me a check when I got finished. And I sold about 1,000 lives a year for about 10 years straight doing just that. So I understood the market. Let me tell you, this market is massive. In the end, it's going to be much bigger than, for example, Medicare Advantage. So when I'm done this evening, what I want you to grasp and I want to prove to you is that selling the Affordable Care Act, or Obamacare, individual health insurance, under 65 health insurance, is easier, faster, and less complicated than you think. It's a bigger market than you think. It's more profitable than you think. It's more secure than you think. And that working with Jennifer, Exertus, Peak Performance, we have proprietary tools in marketing that you don't know about and probably nobody else has. So my job is to help make sure you understand that. So by the way, if you're listening tonight, go ahead and put it on mute for now, in case the dog barks or the phone rings. That'll be helpful for us, okay? So my task tonight, I don't want to scare you. I'm not going to go through all 25 reasons, okay? I might go through many of them. But I'm going to blitzkrieg through this very quickly. This is not like maybe the last time you went to church or synagogue and you were there and it was about 12:30, 12:45, and the pastor or minister says, and second of my 7 points, and you're going, holy cow, what do I smell? It's the roast, it's burning. I could smell it from here. No, my kitchen's on fire. I'm not going to do that to you. I'm not going to slow walk you. We're going to go really fast. I'm going to prove to you why you should be in this space. Number one, it's fast and easy. Selling health insurance, an ACA plan, is an 18-second quote and an 8-minute enrollment. You can complete the sale all by yourself on the phone, 100% online with no signature, no voice recording. And there might be airplanes flying by as you do. Sorry, I live in a flight pattern apparently. Let me just demonstrate that to you so you can see exactly what I mean when I say it's fast and easy. We pull up my other screen here real fast. Not that one. I'm going to pull up my personal Health Sherpa enrollment platform. Let me know if you can see this. I want to make sure I'm using Zoom correctly, because I know sometimes you got to do something to share the screen. So
We don't see the new screen.
okay, let's do this. Let's check the screen share real fast. New share. Boom, there you go, right? So when I logged into Health Sherpa, hopefully you can see it now. On the upper right, it says in blue, quote on X. That means you're quoting on exchange, which means people are eligible for a subsidy, a way to reduce their premium. When I click that, I want to share with you how that you can get a quote in 18 seconds. So what I'll do, I'll use my zip code, 29615. Oh, back up. Start your stopwatch. Ready? Go. 29615. Male 46. And you're looking for moderate to low income people. Now we'll insure and give people good prices if they're higher income, but I just want to do a quick one. So when the green box pops up, you know the quotes have populated. If I were to scroll down, you would see a bunch of quotes, but I'm going to get to that in a second. Let me explain what the green box means. So first of all, the quote was like that. I learned two things, the green boxes. You see, insurance costs two things: what it costs to own it, that's your monthly premium, and what it costs to use it, your deductible and co-insurance. So in this case, it's telling me that I have some savings on what it costs to own it, the premium. It will save me as much as $455, this person, this quote, this individual, on his monthly premium. And secondly, it also will reduce the cost of using it if I choose a silver plan, not a bronze or a gold, a silver plan. There's a thing called CSR, cost share reduction, which will reduce deductibles and co-insurance and co-pays. So that person's entitled to enjoy that should they choose to do so. So now I'll scroll down and I'll show you, there's a Blue Cross plan, another Blue Cross plan. There's some, let's see, some Bright Health. There's some Molina's going to be in there, Ambetter's going to be there. And you see that there's several pages of plans. So the first question is, Clay, you just showed about 10 plans and there's several pages. How in heaven's name am I going to be able to master all those different plans? Don't worry about that. It's very simple. Look at this little one right here. Here's a Blue Cross Bronze 4. Look at the premium. You want to know how much it costs? It's right here. It would have cost $406, but it's a zero because of the subsidy. The Advanced Premium Tax Credit, APTC, we like to say subsidy, is what reduces your premium. Okay. Then it shows you the deductible, $7,200. That's a big deductible. We have solutions for that, by the way, so don't get scared. And then the total out of pocket is another $1,500, $7,200 plus $1,500 of co-insurance. That's the 20% you pay, will equal $8,700 max out of pocket. But guess what? First day, even if you haven't paid a penny for your deductible, you can go to the doctor for $40. You go to the specialist for $60, which is great because I go to an orthopedic because I'm old and creaky. And instead of paying $200 or $250, I pay $60 day one. Oh, by the way, wellness and physicals are free. Everything you need to know is right here in this box. So whether there's 5 plans or 100 plans, you can become a master as soon as you read the box. What else is on the box? Well, if I want to see the list of drug formulary, boom, it's right there. Maybe they take 12 drugs. I can see if they match this plan, if they're on the formulary. Maybe they have 18 doctors. I can check the doctor list. If I have a civil engineer who wants to read all 67 pages of the description, I can click there and show him. I think I'll email it to him. I don't want to read it with him. So if I go through the process and he says, I think I want that plan right there, all I do is click add to cart. And from that point, unless you type like this, you are 8 minutes from being done. Now, I might have just lied to you because when you click on that, you put a name, date of birth, and a state in, guess what? It may populate that person as already in the system. Maybe they have a plan now. Maybe they had a plan a couple of years ago, but their data is there. Well, then I'm going to ask them, have you changed jobs, changed wives, added or subtracted children? Have you moved? No. Oh, guess what? I don't need to add anything. Let's just update, click, 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 and in 4 minutes, you're done. It might be faster than 8 minutes. Now, all I wanted to prove was it's fast and easy, very simple. So let's proceed on. Let me make sure you can see my page again. There we go. Good. So it's fast and easy. I did a demo. And by the way, if you sell Medicare, this compares very favorably, and maybe even with life insurance selling. Number 2, almost half of the enrollees did not use an agent. You see, of those 14.2 million, about 7 million, give or take, several hundred thousand, did it themselves. Now, there's nothing wrong with that, except bad things can happen if they don't have someone helping them like you. You might want to take a note here. Why do they need you? Well, because about 20% of the people who self-enroll end up lapsing their policy throughout the year. Number 2, My services are free, but by using the platform I use, I get notified if they send you a letter or an email saying, hey, we need a pay stub. We need a residency document. We have a question about your tax return. You might ignore it. I'm looking over the system. It flags me if that's requested. I can reach out to you and say, hey, Jennifer, would you take a picture of your pay stub and message me and I'll upload it for you? And I help keep my clients in force. Another reason why they need you is that they might have scrolled down and saw $0 or saw $100 and said, well, that's really cheap. I'll get that one because it looked to be so cheap. They just wanted to get the cheapest one. Well, if they knew how to shop, they might have got a silver plan with less out of pocket. Or they might have got a zero plan that actually had a copay, not one that had no copay. So they may not have got the best plan or best benefits that an agent could have helped them find. Number two, maybe they have a needed provider that's not in the plan they bought. And now they're stuck for a whole year with the wrong plan and they can't see their doctor. Or maybe they take some drugs that weren't on the formulary. So the reason you're helpful is you can help prevent them from lapsing. You can make sure they get the best plan, the right doctor, the right drugs. But the biggest one of all is the last one. Without you, they could make a massive claim and it might not be paid. You know, in August, I was supposed to get that knee done. Let's replace that. They said, let's wait till February. You need to get your sugar down a little bit. Clay likes the ice cream way too much. So I'm working on that. And so here's the thing. What if I had that surgery and they didn't pay the bill? What do you mean not pay the bill? It's insurance. They're supposed to pay the bill. Yeah, they are. But if I made a mistake, they're not obligated to pay. Well, what mistake is that? You know what the answer to that question is by the person self-enrolled? Let me be your agent and I'll tell you. Well, tell me and I'll let you be my agent. No, it doesn't work that way. If my services, which cost you nothing, are not valuable, then God bless you. I wish you well. Well, okay, you can be my agent. It's this. Pull out your card, flip it on the back. There's a website, there's a phone number. It says, here's our network. You must use the network. You never go outside the network. You won't be covered. Now, the exception is if they drag you unconscious by your left foot into the emergency room, yes, it will cover that. But you don't just go into the doctor and hospital you want. I got mosquitoes out here. You don't want to go to the doctor and hospital you want to. You go to the doctor and hospital in the network. In return, you get a great plan for a great price. Oh, by the way, as an aside, and this is not in the PowerPoint, but maybe I should add it. You need to understand something about these plans. Affordable Care Act policies, Obamacare policies, are the deepest, richest, most comprehensive plans ever sold in the history of the world. They're guaranteed issue. There's no pre-existing limitation. The coverage begins first day, and the coverage has no dollar limits. If you have a medically necessary treatment, it will be paid regardless of the cost. That's important. Now, number three. That should have been three, shouldn't it? If you've ever sold Medicare, you know that the first thing you do when you walk into grandma's house and try to sell her Medicare is you sit down and you pull out her shoebox full of prescriptions or her 18-mile long list of providers. And if you can't match those up with your plan, you don't have a sale. And you should do that, by the way, if you're in the Medicare market. You should match up her doctors, match up her prescriptions. 90% of Medicare works like that, and 10% are like my dad, Gary. I love my dad. He's 83. He's awesome. I will never be his Medicare agent. I don't have the patience. I love him to death, but he's the 10% who say, Clay, I don't care about doctors and networks. I want to see the best plan. He's like the ACA client. The average ACA client, you don't start by taking 30 minutes or 45 minutes to match doctors and drugs. Well, why don't you do that, Clay? Don't you care? Yeah, I care, but they're young and healthy. I don't say, who are your doctors? I say, do you have real health issues? Do you take lots of meds? And when they say no, as they typically do, then I just go straight to best plan for best price. If they say, yes, I do have lots of health issues and take lots of meds, then I stop. And as I showed you earlier, I check the formulary, I check the provider list, and I make a sale. That's why our sales, the quote is 18 seconds, the enrollment is 8 minutes, and about 10 to 15 minutes of talk time is all you need. In 30 minutes, you should be done, if not sooner, because you often don't have to look up doctors and drugs. In fact, if you ask most of them who their doctor is, he might say, well, I'm 32 now. I think I got a sports physical when I was 12, and that was Dr. Smith, my pediatrician. Well, you can't go there. You're too big. You'll look funny sitting in the waiting room with the other 3-year-olds. Okay, you can't go there. No use wasting your time. Some clients will say, whoever's working the ER is my doctor. The county clinic is my doctor. So in this market, it isn't usually so important because they're younger and healthier. Those who need it, spend the time and do it right. But understand, this is not the kind of market like a Medicare market where you really have to spend quality time matching up doctors and drugs. Number 4, if you've ever sold Medicare, and maybe most of you haven't, there's a lot of marketing guidelines, but I'll say this, in this market, you can talk to anybody. Unless they are an individual on the do not call list, you can call them. Yeah, you can. And by the way, there are no businesses on the do not call list. Jennifer and I were talking before we started the class tonight. She said, Clay, I got a group of 8 I got to enroll. You can call any business anywhere. And then you start to fish with a net, not with a pole. You don't write many 8 to 10 to 20 life policy sales at a time, do you? You don't write 20 Medicare sales at a time. Well, you can write 10 to 20 health sales at a time. We'll talk more about that later. So you can go knock on doors and visit businesses or call businesses or whatever you want to do. You're allowed to do it as long as you're telling the truth and you're appointed. You know, a significant part of the market is unaware or disbelieving of the magnitude or existence of the subsidies. Most folks are shocked to realize that a male, female, 45 with 2 teenagers making $75,000, which is just below the national average household income and a good bit above what we make. Just a bit above the national income, the average family income, and a good bit above the income here in South Carolina. They can get a Blue Cross plan with a copay for $0 a month. People are shocked. I mean, a middle-aged couple with 2 kids, $75,000 get a plan for 0? Yeah, exactly. A couple age 60 can get a plan for 0 if they make 60,000. Yeah. And people are often shocked at that. Unlike the Medicare Advantage market, there's no annual per carrier certification. However, just one time you do a CMS cert for most of the states, Center Medicare Medicaid Services certification for the most of the states we're working in. And I'm going to clarify that in a few minutes. And then the second time you come back, it's a brief 45-minute, an hour. To be I think I'm getting some feedback. There we go. Number 7, here's how you need to think. Let's see. Okay. You need to think of ACA income as an increasing income annuity. Let me explain. You sell life insurance, you sell dental insurance, you sell Medicare for cash flow. You write it, a couple of weeks later, you get paid a nice check. That's cash flow. And by the way, I'll help you do more of that. Okay. But ACA income is different. You see, we have an open enrollment period. Now we write business all year round, but the most business is written in the fall, November 1st through January 15th. So let's say you write a policy November 1st. It will go into effect January 1st. We will get paid middle of February, and you might get paid as earned March 1st. Well, that took a long time. Yeah. You have to understand how it works. Now, the commissions vary by state and by plan. Blue Cross and Anthem in Georgia and Blue Cross in Tennessee pay very low. Some plans pay more. I'm going to give you a rounded number of $20 per member per month. You may work in a state with a carrier that pays less. You may at times work in a state or a carrier that pay more. I'm going to use this number because Clay's not good at math and I can do that math. Let me explain what that means. I take 15 minutes to sell a family of 4, a plan for 0. I'm going to make $20 4 times a month. That's $80 a month. Times 12 is $960 a year. Let's call that 1,000. You mean if you sell 100 families of 4, you have a 6-figure income, $100,000? Exactly. Oh, by the way, what does year 2 pay you for life insurance? Final expense. Dental plans, accident plans, not so much. 0 to little. These commissions are typically level. I was doing a commercial with a great agency in Florida that we work with closely. And I was there to do a little commercial to advertise a class, a deep dive I was going to do a few days later. Come to my class. And they do a cool thing. They talk about their top performers of the week as they begin their class. And they got to 10, 9, 8, 7. When they got to number 5, it was a guy I knew. I'd done a 2-day boot camp in several cities this past spring of 22. And I met Doug in Cincinnati where I did a class. Doug has 9 kids. I only have 6 kids. He's 50% more man than Clay is. And so Doug, he's a great agent. He can't afford not to be. He'll starve if he's not. So he works really hard. He sells a lot. And they're saying Doug sold 3 of these and 10 of those and 4 of the others. And in passing, they said, and he sold 5 ACA lives. And they kept going. That stuck with me. I got to thinking about that. I said, if he sold 5 lives as an average all year long, giving him 2 weeks to have a vacation, although I don't know what kind of vacation you have with 9 kids. It's probably not a vacation. It's probably very exhausting, and he wants to get back to work so he can rest. But assuming he works 50 weeks a year and he averages 5 sales, 5 lives, which could have been a family of 4 and an individual, which wouldn't have taken him more than an hour to do that week. What does it look like after a year? He writes 5, he writes 10, he writes 2, he writes 0, he writes 8, he writes 4. He averages 5 over 50 months. Well, in 50 months, the next year, he has 250 lives times $20 a live. He's making $5,000 a month as earned, but that's not just first year renewal commissions, that's renewals too. He's paying his mortgage, his car payment, probably his electric bill. In Doug's case, probably not his food bill because he has too many kids, but he's paying all of his bills off every month before he shows up to work. He can afford to be sick for a week. What I want you to get in your mind is ACA income doesn't pay you fast. It doesn't make you rich tomorrow. It's an increasing income annuity. Just throw a few more fish in the pile. Take an hour or 2 a week and throw a few lives in the pile and look back after a year. You're making $2,000, $4,000, $6,000, $8,000. I have agents in my building making $15,000 a month as earned. I have agencies and agents in our agency making $25,000 a month as earned. Now they focus on it. That's the main thing they do. Okay. And that's fine. You may never get to that. You might want to keep selling more life and annuities. That's perfectly fine. I want you to do that. I'm just saying, think of it that way. Now, here's what you need to know about ACA. You don't have to rewrite everybody every year. If you do nothing, they're going to auto enroll into the same plan January 1st every year. Yes, you should call them. It's not like a call with Gary Peak, my dad. He wants you to bring all 10 Medicare books out and go through each one line by line. It's not like that, okay? I would hang myself. It's really a 10-minute call. It's a customer service call. Hey, Jennifer, I want to thank you for being my client. I really appreciate you. Hope the insurance was good for you. Did you have any problems? Any claims issues? By the way, almost never. Well, good. Well, listen, I just want to make sure you have that plan. It's $50 a month, Blue Cross plan, $50 a month. Unless they have a massive rate increase, do you want to keep the plan? You like it? Yeah, I like it. Okay. So if it gets to be over $100, would you want to change? I'd say if it got more than $75 a month, I want to look at other plans. Okay, I make a note. November 1st, I do the rate and it's $68. Say, congratulations, it's only $68. I'm going to leave you where you are. But the real reason I'm calling from a business perspective is to get some referrals. It'll go kind of like this. Hey, Jennifer, blah, 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 good stuff. By the way, before I go, where is it you work? For my notes, I want to make a note. Okay, who's the owner? What's his name and phone number? Who are the 2 people you work most closely with? What's their name and number? I just got 3 leads. Everybody that's ever been sold an ACA plan right now is either a small business owner, self-employed, or works for a business that doesn't have group health insurance. Everybody. So everybody I am selling either has potentially some employees, part-time or full-time, as well as family friends, or has some colleagues, as well as a business owner that I should be talking to. You should be getting 2 to 4 to 5 to 6 to 8 to 10 referrals everywhere you go. More than half of our sales are 0 premium. We intentionally go after the moderate to low income bracket, and we sell lots of 0. Last year, 80% of the quotes given on healthcare.gov were under $10 a month. It doesn't mean yours is going to be that. Obviously, the more money you make, the more you're going to pay, but that's a fact of our demographic. Children, extended family, friends, your Medicare clients, they need this. In fact, if you sell Medicare, in Medicare Advantage, you can't even ask for referrals, but you can say, do you have any kids? You know, I was not probably as good a life agent as many of you. I was a great health agent, not as good at life, but when I did sell some life, really exciting. I maybe go to a young family, age 35, and they had a limited budget, but I sold that husband or wife, whoever the breadwinner was, a $500,000 plan for $37. I'm going to be rich. And I saved their family from total financial disaster. So should something happen to them, when I ask for referral, I get this strange response. It's like, no speaky English. Clay, I don't know any humans. You're the first one I've met. That's somehow the response they get sometimes when I ask for referrals. Not so here. Maybe they watched Groundhog Day too many times. They saw Bill Murray crossing the street when he saw the life insurance agent. I don't know what it is. Some of you are better than that than I am, but I'm telling you something. When you take someone from $1,200 a month to $37 a month, two things. As a life agent, do you think you could use some of those savings to make some life sales? You can. And do you think they're willing to give you the names of people that you can help? Oh yeah, we know they are. Some folks, I think one of my agents was telling me recently, he was enrolling a lady with a child, and the lady was crying when he started to enroll them. He said, "Oh, ma'am, did I say something to offend you? I'm so sorry." She said, "Oh, no, it's not you. It's just that my daughter is 8 years old and she's never had insurance before, and I'm just so happy." You can get referrals like crazy in this space. Now, I'm about to end a point where I'm going to dump some of you off, but let me just get another shot or two in about some important information. Then if you want to go, I'll let you go. Not that you couldn't go anyway, but there's 12-month selling in this space. There's two specific kinds I want to talk about, okay? And then I'll say, if you're not interested, you don't want to pursue it any further, God bless you, have a nice night. You can help enroll people in the lower income brackets year round, okay? What is 100 to 150 FPL? Well, let me show you the screen. Let's see here. I want to hit that screen right there. So the federal poverty level chart, an individual, a single person making $13,590, at least that much, to $20,385 in the states that have not expanded Medicaid can buy ACA year round. Now, I'm going to show you a map. The states that expanded Medicaid, you have a very narrow window, okay? So a family of four making at least $27,000, but not more than about $42,000, they can buy it year round. In a Medicaid expansion state, it's a little thinner line, 138 to 150. Why am I sharing that? Because in 11 states, 12 states, you can write that year round, 100 to 150% of the federal poverty level. Let me point out those states for you. In the other states, you can still help people who are low income, it's just the map isn't as favorable for you. Make sure you can see that page. The orange states, you can enroll year round people in the 100 to 150 FPL, federal poverty level. In the blue states, you can enroll them, but 0 to 138 of the FPL go to Medicaid. So you have a thinner window, okay? So some folks, even though they don't live in those orange states, they target selling those orange states after the open enrollment. So that's just one way to sell year round. I just want to point that out. Make sure you can see my page again. There we go. Another way to help people year round is when you collapse or you terminate a small group health plan and replace it with individual coverage. Now, employers with 49 full-time employees or less are not required by law to have a group health plan. When they do, it's for competitive reasons. And here are the reasons. It's hard to find and retain, write those two words down. It's hard to find and retain good employees. There are as I speak tonight, there are 2 job openings for every person seeking a job. 4 million people quit their job last month, not to watch Netflix on their couch. That was COVID, okay? They went to go find a job with better benefits, better pay. And health insurance is a big part of that deal. Some employers can't even afford a group health plan. The employers of 10, 15, 20, 30, less than 49. They can't afford it to begin with. And they're at a severe disadvantage. When you help those employers get a plan, you help them retain the employees he has or she has and find new ones. So that's one market. Now, when I find a group that doesn't have a group health plan, I'll find them all year long. I'll enroll in November through January 15th during the open enrollment. But when I find a group that has a crushingly expensive group health plan, I can collapse them, cancel their plan with their permission and blessing, and enroll them into an ACA plan that costs dramatically less. So now imagine now that family of four, age 45, with 2 teenagers making 75,000, that employer's paying $600 a month at least for the employee. And the worker is paying at least $1,000 a month at least for his dependents. I was talking to an agent today. The family covers just $2,200 a month. So the numbers I'm giving you are conservative. But think about that guy who's paying, the employer's paying $600 for the employee's paying $1,000 for his family. I just gave the employer a pay raise. I just gave the employee a $12,000 pay raise. I can fish with a net in this market. I can collapse those groups all year round. And here's the thing about it. And here's where I'll leave some guys off the end of this page. There's 50 million people in that space. Right now, there's about 14 million small businesses with less than 50 employees. There were 17 million and COVID wiped out a few million, but they're now close to 14 million businesses with less than 50 employees. Most of them have a crushingly expensive group plan or no group plan at all. This market is so massive and folks don't understand it because they're not working with a field marketing organization. What they're working with is a field contracting organization, but they call themselves an FMO. I'm not bragging. I'm not that smart. I'm not the best agent on this call. I can guarantee you Jennifer's the best agent on this call. And Greg probably is the second best agent on this call. I just outwork people, but I'm telling you from personal experience, no one else is teaching this. No one, I mean, if they are, I haven't heard of them. I've been in 18 cities teaching this face-to-face to agents, been doing 100 webinars this year. No one's getting this message out that I can tell except me. That's a massive market and you can do that. And just imagine when I saved that small business owner $400 to $600 a month and that employee $1,200, $1,000, $1,200, $1,500 a month, how much life insurance I could sell then. I'll get the employer to pay for some life insurance. Oh, and some dental insurance and some accident insurance. We often get the employer to pay for 2 to 4 additional plans like dental, like life, like accident, employer paid, which means 100% of the employees get it and it has 100% persistency. Yes, you can do that in this market. With that, I'll tell you, this isn't turn your crank. I understand. Take a picture. If you change your mind, go to Peak Training, call Jennifer. If you haven't taken a picture, take a picture. If you hang a few more minutes, I'll make you wet your pants. Hope you're wearing Depends. Okay. So enough of you. God bless you. If you want to go, have a good night. I'd encourage you to stay a little bit longer. So let's find the page here. So here, from current slide. So we can get that employer to pay for a couple additional plans. We can help you penetrate the small business market. So Jennifer and I were just talking, as I said, about a small group she needs to sell. We'll teach you how to sell to small groups. You ever talk to a chamber of commerce, a B&I group, a business roundtable, a group of realtors or contractors? All those groups have boring monthly meetings. You could be the next boring monthly speaker, except you won't be boring. You'll be blowing minds. One of our colleagues at work in our Greenville, South Carolina office was really excited. He said, Clay, I got the Chamber of Commerce in Inman, South Carolina wants to see us, wants us to come to their meeting. Inman, where's that? So on a Monday night, I drive to Inman, South Carolina because David got me into this mess. And well, at least we're going to have a nice group of people to talk to. Yeah, there were 6 or 7 people there. Made a presentation. 2 of the people had small businesses, about 20 employees each. One had a group plan, was getting hammered with rates. The other was trying to get a group plan, but said, I can't even begin to afford this. Guess what? That little meeting could yield not just 40 health sales, but 120 dental and life and accident sales. There might be 160 sales in 2 groups. Are you talking to small businesses? I'll teach you how to fish with a net. I'll give you a PowerPoint presentation. We provide extra tools to those who become fully appointed with us for ACA, Affordable Care Act. You keep your life where it is. You keep your Medicare where it is. Okay. You do that with Jennifer and Exertus and those teams. Don't do that with Clay. In fact, our team won't let you. Once you appoint with us for health, you can appoint with us for life. My 6 or 7 contract administrators are like 6 or 7 hockey goalies. They won't let you because all we're doing with this wonderful group is health, and that's perfectly fine. But if you fully appoint with us for health, I'll give you access to advanced teaching and selling tools on my website. I'm going to share the website shortly. This is big. I can't promise this is going to happen, but if it does, it's huge. The family glitch fix. So when the law came out, it was believed, and it was built upon the presumption anybody who couldn't afford health insurance could get a subsidy and get health insurance. Well, as it turns out, if you had an employer group health plan and it was affordable for the employee, which is the only requirement the law has, that for the employee it becomes affordable. If it wasn't affordable for the dependents, those dependents could not get a subsidy. The affordability guideline only applied to the employee and the employer. The employer was not required to make it affordable for the dependents. And by the way, they couldn't. It was just too much money. But even though it wasn't affordable to get on the group health plan, they couldn't get a subsidy. That was called the family glitch in the law. Well, there's high intel that they will likely fix that perhaps this fall. Now, I don't know. I can't promise it. I wouldn't bet my house on it. Maybe I would, but it looks very likely, very hopeful. If it doesn't happen this fall, it's probably happen early next year. When that happens, it'll open 5 million new eligible enrollees a year into this space. It'll make a group of any size, Walmart employee dependents, your school system. If the family or the dependent coverage, not the employee, dependent coverage is not affordable, they'll be able to get a subsidy once it's announced. It hasn't been announced yet. Don't sign up before it's announced, but when and if it's announced, you'll be able to help millions of people. And by the way, just so you understand, this open enrollment, that's an open enrollment sale. It's not a year-round sale. But if you help them during an open enrollment, the sales made between November 1st and December 15th are for a 1/1 effective date. The sales that happen December 16th through January 15th are for a 2/1 effective date. That's how it works in that open enrollment space. Now, what CMS and HHS don't understand is that when employers figure this out, they're going to be pushing more benefits to employees, pulling benefits from their dependents, and driving many more millions to this space. Listen, I mentioned there were 50 million potential prospects in the under 50 market. There are 165 million people on a group health plan, and probably 30 to 40 of them are dependents. And oh, by the way, for all those 165 million that have a coverage, there are tens of millions who didn't buy the group health plan coverage because they can't afford it. That's a massive market shift, the biggest shift of sales in the insurance market since Lloyd's of London in the 15th century. All right, moving on. A couple more things and I'll stop. One thing that makes us different from every other FMO, I don't care who you talk to, we understand a thing. When I go to that small group, like Jennifer's going to go to, and let's say they have a group health plan, a group of 8, and they've had a group health plan, but it's really expensive. They want to go to ACA, and they do. Let's say 4 of them get a 0 premium plan, but the other 4, 11, 23, 58, $112, because maybe they have a bigger family, they make a little more money, they want a better plan. These 4 have no premium. These 4 have a modest premium. All these years that employer's been paying Blue Cross or United Health or Aetna for a group health plan. But these folks have an individual plan, not a group plan. It is against the law for the employer to write a check to the same company, Blue Cross, for an individual plan. It's a $100 per day, per employee penalty forever. So you can't do it. So that means that these 4 are going to have the premium taken out of their checkbook. Now, so Jennifer makes a sale. They're very happy. She sells some life, some dental, some health. They're all happy. They cheer as she drives away. She comes back 6 months later, and the 4 over here, they're paying 0. They say, hey, there's Jennifer. She's the best. And over here, the 2 are giving polite golf applause. The other 2 are looking like this. Jennifer, man, loser. Well, she goes, what happened? Why are you so upset? And the 2 that are folding their arms and giving her bad looks are saying, well, Jennifer, I had that plan, but I blew my transmission and it cost me $3,500 and I couldn't make my payment. I lost my insurance. Oh man, I'm so sorry. That one said, Jennifer, I've got 4 kids and tennis shoes and book bags and clothes for school. I couldn't afford my payments and I lost my coverage. She says, I'm so sorry. I'll come back in November and I'll re-enroll you for a January 1st effective date. Okay. One says, not so fast, Jennifer. You see, my spouse, she has breast cancer. And tomorrow, she's to go to the Medical University of South Carolina and get an $84,000 outpatient chemo treatment, but we don't have any insurance. And on the way home, we got to drive through CVS to get some anti-nausea medicine that's $6,000. And here's what we discovered, Jennifer: CVS don't take no IOU. How are you going to fix that, smart girl? On the previous page, it was a beautiful idea to go collapse groups year round and fish with a net. But now I got a problem, and I get to see if my E&O insurance works. Not if you work with us. Not if you work with us. We'll teach you an IRS compliant way to bolt down those premiums so that they never lapse because of non-payment. You need that. If you're going to be in this space, it will separate you from every agent in America. Of the 300 or 400 agents who do this, all but about 25 work with peak performance, because we're about the only group out there teaching it. We can teach you how to bolt down those premiums so that they never lapse for non-payment. The only way it can lapse, the employee quits. Well, they're no longer your employee then, are they? It's got to go back to their own checking account. Or if the employee marches into the boss's office and says, "Boss, listen to me right now. Cancel my dental plan, that free dental plan you're giving me. Cancel that free life insurance. And for heaven's sake, stop that $11 payment going to United Healthcare. Don't ever do that again." Really? What? Really? Yeah, really. Well, that one could lapse, but that was the choice of the employee. We can help you sell it. We can help you bolt it down. One more big thing, and I'll skip to the end, okay? The American Rescue Plan dramatically increased the amount of income a family or an individual could make in order to get a subsidy, and went into effect May 1st, 2021. It changed the game. It brought millions of new prospects into this space. I'll give you an example. Back in 2020 or 19, whenever it was, 19, when I was just 60. Yeah, you thought I was 83, didn't you? You know, I was just 63. Stop it. And so when I was 60, Debbie and I had a Blue Cross plan that was $1,600 a month, because at that time, if you made more than about $75,000 or $80,000, you fell off the subsidy cliff and didn't get any subsidy at all. You had to pay for all of it, and it was $1,600 a month for a bronze plan. After ARPA, if we made $250,000 a year, our plan went from $1,600 to about $880, almost cut it in half. But only about 7 or 8% of the population make $250,000 a year. What if it was just in a nice high, middle, high income group, 125,000 for a couple? It would go from 1,600 to about 350. You can't buy a short-term medical plan for 350. No, by the way, if you found Clay and Debbie and took them from 1,600 to 350, do you think you could squeeze a couple of $100 of life insurance out of me? You could. Well, that's now been extended for 3 more years. Let me tell you something. By that time, after 3 more years, it was due to end December 31st this year, but now it's been extended when Joe Biden signed the American Rescue Plan back on August 16. You know, the one that had 87,000 armed IRS agents. Yeah, that's great. But there's some lemonade in those lemons. And one of them is he extended the subsidy for high income for 3 more years. Let me tell you something. Once it's been in effect 5 years, it's hard to end. Let me give you some history. It's not red or blue, just some facts. In 2010, of March 2010, the Democratic House voted with no Republican votes to pass the Affordable Care Act. As a result, in November of that year, 60 to 65 of them got voted out of office in many swing districts, and the Republicans took over. Fast forward to 2018, not a political statement, just some history. In 2018, the Republicans lost the House to Nancy Pelosi. What was the highest poll-tested reason they lost the vote in those swing cities? Was it orange man bad? No. The poll-tested question was whether it's truthful or not. We can debate that if that was really the case, but the message that was received was, hey, the Republicans are going to take away your health insurance. And that caused it to swing. Once you have those benefits, it's hard to take them away. Can you imagine taking away Medicare, Social Security? Well, after these many years, the lawsuits are done. The legislative rallies to end ACA are done. When John McCain went like this a few years ago, it ended. And then when the Supreme Court made a couple of decisions to not retreat, not repeal it, it's pretty much over. And now they've added benefits to the higher income people. It's going to be hard to take it back. Lastly, we have a unique way to help nonprofits, private Christian parochial schools, food banks, Boys and Girls Club. Those folks are right dead in the demographic of people that we love to help. We will talk more about that in the future. So if you would like to do this, I'm going to show you exactly the next steps. We have a website, and everything you need is on one page of one website. There's a map that starts with step one, this class, a little longer version of this class with more details, and I'll slow down and give more illustrations. Then how to certify, how to contract, how to get set up with the health platform, how to get some training, on the way through to some marketing tools, to how can I collapse groups and write 1,000 lives 12 months a year. It's all on my platform, peaktraining.com. If you go to the 12-month health sales tab, you'll see all that information. What you're seeing today is just the part of the iceberg that's above the water. Okay, you're just seeing the tip. You thought it was a mountain. No, it's an iceberg. And 80% of the information is still below the water. You haven't seen it yet because you haven't accessed our site. There's so much more to know. There's so much more we can teach you about marketing in this space. We provide the proprietary training to our partners. About half of my page at Peak Training is open for anybody to see. The bottom half with the really, really good stuff, you have to be fully appointed and get access to our advanced training to see. But we'd love to partner with you. Now, if you'd like to build an agency, that's exactly what we're really good at doing. We'll help you. We'll do webinars for you. I'll do live training events. You can invite your people to. I do about 100 to this year, maybe 200 webinars, just like this one tonight. We have all the agent data of those who've taken the CMS cert. We can give you some data if you'll fully appoint and want to recruit agents. We'll help you build it. We're like the car jack that lifts, that does the heavy lifting so that you don't have to. You don't want to mess with contracts. You don't want to have to create your own back office. We've already done that. You can focus on selling and sharing the message with other agents if you'd like to build an agency. Even if you're a newer agent, we can do that for you. You don't have to explain agents how to do the certification. You don't have to explain them how to set up their enrollment platform. We'll do that for you. We have electronic contracting. We'll do that for you. We process the payments. We use a third-party APL system to provide online contracts every month, every agent, every carrier. And I have an agent care team. His name is Greg Fortune. He's on the phone call right now. Greg, you still there, buddy? Or are you watching Facebook? What are you doing? But people like Greg and others, David, John, Laverne, Steve are on our team to help you do what you need to do, to help you learn how to get involved. So if you'd like to engage, and I'll show you a little bit, do so. This is where you go. When you go to our website, peaktrain.com, I'll show you exactly how to navigate to go to the prep class. We'll teach you everything you need to know to engage. And when you appoint, the reason I want you to take a picture of this page with your phone, go ahead and take a second. If you didn't do it before, take your phone out, take a picture. If you're direct to Jennifer, that's her individual specific contract link. If you're part of the Exertis team, there's a link for them. And if you have a manager, then there's a place to put the manager's name. If you work with Teal, one of the managers at Exertis, he has his own site, his own link. These are contract links. But before you do that, take a picture and save it. Okay, 4, 3, 2, 1. Let me take you to the site. I'll show you a few things. I'll take your questions. We'll be done. Okay, so I'm going to take you to peaktraining.com. Going to make sure you can see my screen. That's the generic page. And you click on this tab, it says 12-month health sales. See that tab? You click that tab, it'll open up the 12-month journey. You'll see that map I just referred to. What you're watching is a very fast version of the opportunity show. If you'd like to see it in slow motion, it's step 1, what I just talked about, okay? Step 2 is how to get contracted, certified, set up your enrollment platform. Step 3 is some basic training, some advanced training, some advanced selling tools, and how to collapse groups and write 1,000 cases a year. It's all on this page. So if you want to see it again in more detail or hear it again, there's step 1, what I just basically gave you in a shortened version. Step 2, if you say, Clay, I'm in. Jennifer, we're going to do this. Step 2 tells you everything you need to do to get to where you can sell. The ACA prep class, and there's the PowerPoint that goes with it, with all the notes and details. You can click that and watch it. It will tell you how to certify, how to contract, how to make sure you're appointed, how to set up your selling platform, how to get to some training, all that's there. It'll walk you through step B, step C, Contracting in D, platform in E. It'll take you through the basic training, all that's there. Okay. And then on down the page to more and more training as you scroll down the page. Now, I want to show one more thing and I'll stop. When you appoint, there's an interactive map that you see in the contracting link. If you live in Texas or sell in Texas, when you click on Texas, it'll tell you all the plans we sell in Texas. If you're going to do this, you should get all the plans that are in the states you want to sell in. Now, if you live in Illinois, but you have a non-resident in Texas, don't appoint in Texas. You see, there's more business in Illinois than you can shake a stick at. And the more time you spend not in your own town and neighborhood and county, the less effective you'll be. If you have a ton of clients in Texas, if you get a ton of leads in Texas, go ahead and get a non-resident, get appointed in Texas. But if you're an Illinois person, focus on where you live. You can build so much business where you live. And yes, you can do it on the phone, but the more you magnify your presence where you are, the more you'll sell. You don't have to be in 37 states to make this work. You can get leads and referrals everywhere where you live. So if you market and spend money in 37 states, knock yourself out. But if you don't, focus on the states you're in. Now, what do the colors mean, Clay? The colors are this, the blue states, and you'll learn this in the prep class. So I'll just give it a light reading, then I'll refer you to the prep class to watch the rest. The blue states are states you can do one CMS cert and you're certified in all those blue states. One test, one certification, works for all the blue states. Then what are the yellow states? Those are some of the state-based exchanges. They don't use our health serpent platform. They use our own state platform to enroll. You have to do a separate state-based exchange certification. So if you have a cousin in Colorado, but you live in Arkansas, don't do it. Say, cousin, I love you, but no, I'll give you a phone number, call them. I'll give you a website, go there. It's not worth it. I love my cousin. You got to find your own health insurance because you don't want to spend 10 hours taking the Colorado certification or however how long it takes. You don't want to do that. It's not worth it. Now, if you have 300 clients in Colorado, yes. Even if you live in Arkansas, get Colorado. So just get the states you need, not all the states you have or want. You don't need it. You'll never sell it. It'll all do is clog up my office and clog up you. I wouldn't sell in the yellow states unless I live there or have a massive boat of business. Okay. What are the gray states? Those are states we don't sell in. Why? Sometimes there's not enough population. Sometimes they don't pay enough commission. Okay. We're considering adding Nevada. If we do, we'll do it the next 3 weeks. So when you appoint, get all the plans. Well, Clay, I've only heard of Aetna and Cigna, United Health. I haven't heard those others. Doesn't matter. Come November 1st, you might need them. Bright Health might be breaking your kneecaps in that zip code. And you're thinking, doggone it, I should have listened to Clay and gotten Bright Health. And you'll say, Clay, we need Bright Health. And we'll say, well, it'll take you 5 weeks, but we'll put your name in the hopper because maybe they'll be backed up. Get them now. Don't wait. It's better to have it and not need it than to need it and not have it. So if you want to take action, go to peaktraining.com, hop on that 12-month health sales tab. And the thing you should do is go to step 2, 2A, the ACA prep class. It will tell you everything you need to know to get you from, I'd really like to do this to I'm writing business now. And with that, I'll stop and say, Jennifer, ask me the questions. And we'll stay and answer as long as they want to, okay?
Well, thank you for all of that information. That was a lot of very, very good stuff. And just everybody who's on here right now, some of you guys have already started and initiated your contracting process with Peak Training. And so your next step right now is to head over to peaktraining.com and make sure that you set up your free account on this website so that you can not only access the first 3 levels of modules, but the more extensive things too. One thing I want you guys to remember is that, you know, we can write business all year round, but you want to be mentally prepared before November 1st happens. You need to ask all of your questions before November 1st. You need to start thinking about what types of groups you're going to reach out to. Start making your lists. Start doing your Facebook searches, start priming your pages, and then you'll be ready for open enrollment. You'll be ready for season, right? And you'll feel confident with the process moving forward. So I'm going to look at the chat real quick. I know that there was one question asking if we had access to your PowerPoint.
On this step 1?
Yeah,
Opportunity
but
share
you answered that because it's on
is right
the
there. PowerPoint right there.
recording. I see a lot of great info. Thank you. Nikki said you're super amazing. Manny is very excited. Me too. Jamie is too. And Jezebel asked, what comes after meeting a business owner if they say yes? And the
Okay.
next person, I don't know who is
Let me answer that one real quick. Let me answer that one real quick. So when you're fully appointed, you can watch everything on this page except ACA University for free, even if you never appoint a single carrier with us. Fine. You'll write 200 lives this year if you never appoint with us. God bless you. You're now competing with us, but it's okay. If you appoint fully with us, you can send any of us an email, send Greg an email, send us an email, and we'll grant you access to the advanced classes. And that gets you ACA University. I'll scroll down to step 4, Health Insurance University, some additional classes, marketing tools, Facebook ads, slicks to pass out to businesses. And then lastly, what you just asked me was, the business owner says yes, what do I do? This is an 8-series video class, and that has a small paywall. It's the only thing on our site that has a small paywall, $79. It will teach you everything from which businesses you should not write, which businesses you should write but not right now, how to bolt down the savings, the payments, so that they don't lapse coverage, how to make the second and third sale so the employer's paying for them. That's all right here in step 6. Agents do this will sell 1,000 to 2,000 lives a year, or policies a year. So that's where all that is right there. That's the gold.
Does anybody else have questions? I don't see any other questions in the chat, but you are welcome to unmute and ask or type them in. Now is that time. And I think everybody should do the advanced training, because there's a lot of health agents out there, right? But we want to be able to offer something that they can't. We need the thing that separates us from our competition. And what I'm going to be focusing on is the small business groups. And my group, we're going to be focusing on these small business groups, because guess what? They have all of our clients. And we can nickel and dime calls. We can try to pick up the phone and get one person and one person and one person from, our communities. But if you pick up the phone and you call a restaurant that doesn't provide any benefits, and they've got, servers and bussers and people who are waiting tables and bartenders and people who are, a family of 5 making under 48,000 is most communities. That is most communities that we have, either where we live or somewhere close to where we live, right? And so that's going to be your bread and butter for sure.
Yeah. Jennifer, if you like selling life insurance and annuities and high volume, high face amount policies, in helping that business owner, you're helping a business owner, the guy who makes the money, the guy who has some assets and some net worth. You help his people, he'll talk to you about his life insurance.
Yeah. Yeah, and I can tell you that the reason why most people don't have it is because of the finances. So if you're making a decision, a choice between the affordability between life and health, they're always going to choose the health. But leads is always an issue in this industry, right? And what's the best way to talk to somebody is to present them with something when you're not asking for a credit card at the end of it, unless they want to. Yeah. You're giving them the option to say yes to a $0 plan. Now, might it be best for them? Maybe, maybe not. That's part of our education with them, right? Asking them how much services are they using, asking them, what do they need access to? That's going to be a little differently for everybody. But the majority of the people who you're going to speak with, they're going to say, give me the better plan, that $silver plan, the one where I can get more services for less. And they're still getting that subsidy. Now they can get really good care, and it might be $50, it might be $60, but it's not going to be $1,000, right? When they're in that income bracket. And how many people do you know that have a job and they work with people who they care about? You spend a lot of time with people that you work with, whether you have a job now or you have in the past. Us here, we're constantly speaking all day long, right? And so they're going to share with the people who they work with that make the similar amount of income that they do, the people that they complain to all day about their job not giving them the benefits, and you're going to be solving a problem for them. And you can feel really good about that. So I'm excited to do this. I hope you guys are excited to do this. And let's have a super successful season. If you guys need to be contracted, reach out. We'll go ahead and get you set up so that you can start that process. If you've already begun it, go to peaktraining.com, start working your way through the videos that are there. Nikki says, let's get this money. Let's go, girl. All right. Does anybody have any comments, questions, concerns, anything that you want to say at this point? If not.
Yes, I have a question.
Okay, what is it?
How long after doing a referral can you expect to get paid?
So what you write November 1st will go effective January 1st. We will get paid mid-February. You'll get paid around the 1st of March. Just understand it's a long time to get paid.
For the open enrollment.
Month,
for the open enrollment policies.
Yeah, open enrollment. But then it's every month.
I think she's asking you about an SCP though. She actually wrote an SCP and did an referral.
If you write today, it gets effective November 1st. We get paid mid-December. You'll get paid in January. So think 45 to 60 days, closer to 60 for the first check. But once they start, every month.
Every month.
Yeah.
Okay.
One thing about this space, like he mentioned, it's like an annuity. It's buildable income. It's predictable income, and it's your bill pay money, you guys. This is you setting up your base pay that you know that's coming every month once it starts. So now you can have a predictable business, but he's just talking right now about your ACA, but you're also going to add vision. You're going to add dental. You might add a cancer policy. You might add something else. Your life insurance, their tax-free retirement. You might be talking to somebody at a job that is struggling. They have medical bills. They're not getting proper treatment. They're stressed out. They're probably going to lose their job, and you're going to prevent that from happening for them. And while you're sitting there, they're going to start telling you about the doctors that they're not seeing because they need to and they don't have a policy. They're going to be telling you about the medications that they used to take and they stopped and now they need them again. And then you're going to realize that if this person leaves that job and they get a diagnosis, they need, first of all, that life insurance policy now. But do you think they might have a mortgage that they can't afford to pay? That is getting eaten up by the cost of not having a policy that they feel like they can't afford to have. And then we are showing them an option to be able to put something in place to protect their health. Now their stress level's gone down. Their boss is happy because they're performing better. They feel better. So their life is going to improve. You're doing that for them. And they're going to tell everybody that they know about us. And that's what we want to do. What we are doing is life-changing for people. But we also have an incredible opportunity to help people to get out of debt with their life policy that you've never had an opportunity to talk to before. And that's going to pay you thousands. That's going to be thousands. And now there's an underwriting process. It's going to take a little bit to get paid out, but that's on top of your bill money you created through ACA. So now you don't have to stress that it might be 45 days or 30 days for a policy to go through underwriting on the life side so that you can pay their debt down with dividends they didn't know existed prior to talking to you. So you're changing situations all the way around. So think of this as a way to get in front of people you never would have had an opportunity to talk to. And here's the thing, Clay did not mention it on tonight's call, but there is an opportunity to free up money, and it's in that peak training. I'm not gonna go more into it, but watch for it. It's in the peak training, and you can help the business to get access to grant money, to money that's owed to them. If they had W-2 employees during this pandemic, whatever you want to call it, right? So they have now access to those funds that they can use to offset some of these necessities that especially now and he's showing you. So especially now that that they need. And so just getting in the door, either no matter how it happens, you picked up the phone and you called, you walked in, you were eating and you happened to ask, you seem to be very happy here. You must love your job. They might give you really good benefits. No, I like my job, but they don't give me anything. They probably work with other people that feel the same way. So now the job probably wasn't even offering benefits because they were like, where are we going to get the money at? That's another bill for us, right? We just lost 2 years of income. So this is fixing a lot of problems. And so if you can lead with something that they aren't pulling a checkbook out for, and you are solving a financial situation for them, you think they might give you some referrals. They might feel like, we have something that we can offer them. And the thing is, this is available. They don't even know.
Yeah.
They don't even know, because if you knew you didn't have to pay monthly for a health insurance policy, do you think you would have one? How many people on this call right now don't have one? I'm gonna leave you with that.
So good. Well, Jennifer, I want to work with you. That's awesome.
I'm gonna sign you up.
Sign me up.
I got a link for that.
And there they are. Take a picture.
There they are. Take a
The prep
picture.
class. It'll point all those things she was talking about, the dental sales, the help of small businesses who may qualify for grants. It's all in that, on that page. And peak training will tell you where it is. And you watch the ACA prep class, it'll walk you through all of that very simply. So, well, guys, no more questions. I guess we're done. I appreciate your time. Thank you, Jennifer, for inviting me. It was so good to visit with you guys. And I hope I'll see you one day soon. We'll do a training
Thanks,
somewhere.
Clay.
Invite everyone to come.
Thanks, Jennifer.
Thanks
Thank
all.
Welcome.
Good.
Thank you guys so much.
God bless you. Good to talk to you.
God bless you too.
Right.
Bye.
Good
Bye-bye
night,
now.
everybody.